Approximately 300,000 cases of hemothorax occur each year in the United States. The volume threshold for drainage and the size of drainage catheter use has been challenged recently. Additionally, the management of retained hemothorax is critical due to the risk of empyema and other complications. The objective of this study was to evaluate critical questions in the management of hemothorax. Using the grade methodology, the East Practice Management Committee performed a systemic review to answer 4 questions. Whether tube thoracostomy versus observation should be performed. Should pigtail catheter versus thoracostomy tube be placed to drain hemothorax? Should thrombolytic therapy be attempted versus VATS in retained hemothorax? And should early VATS versus late VATS be performed? 2 retrospective studies were used to compare tube thoracostomy and observation. 2 prospective observational studies, 1 randomized control study, and 1 retrospective study compared pigtail and tube thoracostomy. 1 retrospective study, 1 prospective observational study, and 1 randomized controlled trial compared thrombolytics to VATS. And 5 retrospective and 2 prospective observational studies compared early to late VATS. The authors were unable to recommend for or against routine drainage of small hemothorax. The group conditionally recommends using pigtail catheter drainage over tube thoracostomy. Additionally, the committee conditionally recommends VATS over thrombolytics for retained hemothorax. Lastly, the committee recommends performing early VATS for retained hemothorax, with early VATS being at less than or equal to 4 days. How will you manage hemothorax moving forward? For a more detailed summary of this practice management guideline and for many others, please visit www.east.org.